Oh, hi there. How are y'all doing today? I'm Dr. Trimble, and today I'm going to be talking to y'all about antibiotics. It's one of the most common things that we talk about in the office during sick visits, and I think it's very important that we approach this subject because families have lots of questions about antibiotics, whether an antibiotic is appropriate to use in a situation or not. So I'm going to go ahead and go through some of the top 10 questions as mentioned on healthychildren.org's website, which is a validated American Academy of Pediatrics website. So colds are actually caused by viruses. Okay? Viruses, unfortunately, are not killed by antibiotics, and so, in fact, it can be counterproductive to give an antibiotic for when a child has a cold, even if it is a severe cold. Well, no, actually, not all ear infections are caused by bacteria. In fact, a number of them are caused by viruses, and it's very difficult to differentiate the two, but there are certain things that we can do from our history and from our physical exam, which is why it's very important, if you suspect that your child has an ear infection, that you come in for a visit to be evaluated to determine whether or not your child needs an antibiotic. Well, actually, 80% of throat infections in children are actually viral. So the vast majority of children do not have strep throat. However, because of strep throat requiring treatment, because it can lead to other problems, we do strongly recommend, if you feel as though your child is having fever and sore throat, that you bring your child in for an evaluation. So yes, antibiotics can have adverse effects, and it's important to know that those can range for things that are mild, like a rash, or stomach ache and vomiting, which are common complaints, all the way to severe rash or allergy. And so it's very important to know that some of these reactions can be mild or can be severe and life-threatening. So antibiotics are not without their potential for side effects. It depends upon the child's condition and how the child metabolizes the medication, but what I can tell you is in most situations, it takes between 48 to 72 hours for antibiotics to reach full effectiveness. Some are a little bit longer and some are a little bit shorter before they start to become effective. So it's important to speak with your doctor or your other healthcare provider to understand how long your child might be contagious for and when your child might be expected to have some recovery. Yes, antibiotics can cause resistance in the community and within your family. And so it's important to know that in order to prevent resistant bacteria, which may require antibiotics to be given in a hospital or through an IV, or a much more broadly based antibiotic, which can have more side effects, it's important to know that we try to be as judicious as possible in the use of antibiotics to prevent your child from having a resistant bacteria. So when we talk to families, in almost all situations, there are very few, if any, medications that can be used for viral infections, such as colds. However, there is a medication that can be used in certain situations, such as Tamiflu, if your child has the flu. And what it will do is it will reduce the likelihood that your child transmits the flu to another person toward the end of their infection. Most importantly, what it does is it reduces the duration of a child's fever by 1 day. And so I want to stress this point. Antibiotics are used in specific situations at specific doses and for a specific amount of time. If we use someone else's antibiotic, or if we use it for a time or a frequency that's not indicated for the antibiotic, we may be exposing our children or our families to medications that either have some severe side effects or that could cause problems such as too high of a dose or too low of the dose that could lead to either the illness continuing or not completely eliminating or eradicating the illness. And so it's very important when you get a prescription for an antibiotic, it's for that particular reason, at that particular time, and for that particular duration of time.